and the program is still Top Talks on OPC Television. Kayode, how are you?
I'm fine. Oh. So today, we're talking about COVID-19.
Yeah.
And yesterday, Nigeria we recorded 1,244
1,000 plus. Yeah.
new cases of COVID-19. Now, we've gone away from the one-digit number of cases. We've gone away from 2 digits, 3 digits. Now we're in 4 digits now, and it's what we are trying to see now is that this thing is getting to a lot of people now.
Mm-hmm.
It's getting to a lot of people, spreading very, very fast. And I saw one headline, NCDC is saying it's spreading faster with mild symptoms and everything. And we should also acknowledge the fact that we have gotten to I think 100,000 cases of COVID-19 now in Nigeria, 100,000. So we are saying that we need to be more cautious now, because we cannot say it's better than this again. We have been trying our possible best to tell people, but I don't know, maybe it seems that it's not working, or is it that people are not adhering to the rules and regulations that the government are putting in place?
Do you think the government is strict enough?
Or if the government, to some extent, they are not even doing their own part.
Because the reason I asked that question is, I remember during the first wave of the COVID-19 pandemic in 2020, the state government, especially Lagos State, they said a bus of about, I think, 18 seats or something, you go 3 to a seat or 2 to a seat to the likes of the smaller buses. But presently, the state government is yet to put down any law that is limiting these people and the amount of passengers they take. You still board buses in Lagos and they're taking about 5, 6 on a seat, and you look around the bus, you are like the only one putting on a face mask. And it
happened so many times.
It seemed like
but see, we need
you are even being extra.
We need
to get that reaction
we need
from
to
people.
Understand that the kind of government that we have now, they don't put guidelines, protocols, rules, things that people should follow. They don't adhere strict. Okay, see what we have now. We have NIMC registration NIN.
Going on,
we 60 years. I think we are 60 years now. We don't have a data for every single Nigerian. And we are saying that, okay, this should be done, this should be done. It cannot be done that way. Do you know how many buses that we have in Lagos State? How many would they be monitoring now?
No, it can be managed actually, because
but they're not serious about
wave of the COVID. That is what I'm saying.
They're not serious about
during the first wave of the COVID-19 pandemic, that was why a lot of bus price was, multiplied by 2 and all of that. Now. It's still, some of them, the same amount they take. So you look at when you're boarding buses today, they still take about 4, minimum of 4 on a seat. And you get home, you put on your phone or your TV set, and you see the numbers, the way they are rising. And you're like, are you sure we are in this same Nigeria? Are you sure it's this same Lagos that these numbers are pulling in like this? And people are just living their life as if, that one is for the government. The fear is when it's... Someone said something to me yesterday. It says Lagos has actually scattered, but we don't know.
We don't know.
We don't know. Because everybody's still acting as if, look, COVID-19 is for a particular set of people. COVID-19 is for the rich, it's for the politicians. But today I'm beginning to see people come up on social media to say they tested positive to the virus. You see people even on your WhatsApp. A friend was telling me a couple of days ago that her classmate said her dad passed on at Luth from COVID-19 symptoms that they didn't even know early enough, that the entire family has to isolate now. And so I'm like, in between this, we are just still living like we don't care.
Yeah, what you said, I was talking to a friend, I think on Thursday. So we were having an interaction. I was like, guy, see, they wear your face masks now. They wear face masks. And you're like, do you think it's real? I said, see, I'm not part of people that will be saying this thing is real, it's not real. My own is that my health, if you are going to be coming to my own house, you are going to be coming here, please, you need to be wearing face masks. We will stand in front of our door
and ask you to
I will give you hand sanitizer. Yes. You rub and you cannot come and destroy.
Exactly. Exactly. And maybe because we heard there's now a vaccine, or Nigeria is receiving 100,000 doses of the COVID-19 vaccine. But I hope we also saw the news. I think I saw it on CNN that said you could still contract the virus after using the vaccine. So it's a situation of on your own. after you've used this vaccine and you are fine, you can still contract the virus again. So it's just as good as there is no cure.
We cannot be sure about this vaccine now. We cannot be sure because we have seen cases of, I've heard stories about people that use the vaccine and they died. But we are not sure if it is the vaccine because we've not tested it and we are not sure about it. But what I'm just saying is that we should leave the vaccine aside. The only people that can help us is we ourselves. Because if we start maintaining this social distancing and really, during this Christmas we had celebration last year, Christmas, New Year, people were doing get together. About 1,000 in a particular premises. You understand? We are doing pool party. These are ways that you can actually get infected with this virus. You understand? What are even the best place where you just dip your dirty this thing out and everybody will get infected from that place. So what I'm just saying is that we need to be cautious of what we are doing now, because that's why I was telling someone, I said, if you know that you cannot, if you get this COVID-19, you might not be able to surpass it or you might not be able to come out of it. Please don't go anywhere. Just stay in your house. You understand? Or just find
when you know you don't have a strong immune system. Yeah, some people already knew. I think I saw a lady I read on her story who experienced the COVID-19 virus. She said on a normal day she has a low immune system. So imagine such a person being exposed to a raving pandemic like COVID-19. So, and she even knows she has low immune. Some people don't even know. They don't even know if their immune.
I have a friend like that too.
They don't even know if their immune is strong. When did they visit the hospital last? Once they buy paracetamol and alabukun, they are good to go. We move. We don't even know. And one thing the virus does, I think itself is not like it really kills. It just kills certain that's supposed to fight them, and then when you have probably the person has an underlying health issues, it just makes it extra. And a lot of people are walking the street of Lagos not knowing their health status. Some people have some sort of disease that they don't even know they have it, because Nigerians, we don't have the culture of visiting the hospital. We don't have a culture of just going to the hospital and just running tests. My dad used to say something. He would say he has to visit the hospital at least once in 3 months, and everybody just look at him like, what is wrong with you now? I think growing up, I got to understand that, okay, it's actually a lifestyle that everybody should have that. So in a situation like this, you already know this is what I'm exposed to. Already I have this issue, but a lot of people don't even know. A lot of people don't know. The other time I was coming to work and someone just slumped. And a lot of people, I think I told you something that they lied him on the ground and looking for people who knew him. And I was telling someone that this person would have had one issue that because he never visited the hospital, he never knew. So imagine now you have one issue that you don't even know about, then you now anyway, I don't know, but I feel like when thing is happening in the developed nations, is they know they have a system that works. They know they have their health sector. The first wave of COVID-19 told us points clear that, look, Nigeria does not have an health sector.
And now, talking about our health sector now, the NCDC, they've come out and said that very soon, the medical society and everything, they might not be able to bring in many people to come and start treating them now. Now, it's now you. If you have COVID-19, you start treating yourself now. That's the way it's going to be very, very soon.
But why is it not? It always seems like it's in the news. It's like in reality, nothing is happening. I don't know if I'm the only one getting that feeling. It seems like it is only when I put up my TV set or I go online, that is when I see videos of people who have contracted the virus. That is when I see news that is telling me this number of people. But in reality, everybody seems to be living like nothing is happening. Everybody seems to be living like we are normal, we are okay, that one is them. You don't get, you bought a bus and you're about 6 in the bus, only 6 on a seat or 5, and you are the only one, max 3 people. In Lagos, there's only 3 people that
you need to understand that negligence did not just start from the COVID-19 time. It has started for a very long time. So it's going to be very, very difficult for us to adapt to things like, okay, follow this rule. We have seen, okay, please don't dump refuge here, and that's where they're still going to dump that refuge. Negligence is already part of some of us, because I know some people that that adhere to this rules and regulation strictly. They don't mess with it. They don't play around things like that. They understand their immune system. And
that's what I'm saying. That one they understand. Some people don't understand at all.
Okay, now see what these things are going to affect in our Nigerian economy, in schools. We have seen ASUU now. They've settled their stuff with federal government. Now, these students are able to resume now. They cannot resume because of the virus. Now, for 1 year, they didn't find a way to make sure that there's an alternative, that students don't need to come to class. They can do an online lesson. They can do an online lecture, something like that. They did not figure all those things out. Private universities, state universities were busy doing things like that. We have students that they're already in their 2nd year and they are doing fine. They are just doing their normal lectures. And we have federal university students still at home. 100 level students of last 2 years, it's still at home and it's still in 100 level by now. And you are telling that students, what do you want them to do?
I also saw in the news that tertiary institutions are saying they might not be able to resume this year at all. So you can imagine somebody that gained admission in 2019 and was in 100 level, is still in 100 level in 2020, still 100 level in 2021. And
for the people that want to go and serve, that finished 2019,
for me, I still feel like next year. Anybody that wants to go for the NYSC program at this moment, just get busy with your life.
Yes.
Get busy with your life, because we are in the midst of that's not even as important as education.
Education, yes.
You're done with the primary thing, which is going to school.
But you know, some people want to further, and without them doing this NYSC is like a barricade.
School is not even functioning. So. Which means get on with your life. The only people I feel really concerned for are those who are still in the system. Kids in primary school, kids in nursery school. My friend was telling me, I think yesterday night, that she visited her mom, and where they stay in, not so developed areas of Lagos, that a lot of them are not going to lesson because their parents cannot afford it. So he said these kids went to learning trade. That she saw her mom is like, look, all of them had learned different, and hairdresser. That was a young girl that made her hair, another small one made her nails. So I'm not like, so if you are even an adult already and you are waiting for us to and all of this, this is the time to actually get busy with your life.
This is the best time to learn a skill, to acquire something, to acquire a knowledge.
Even if it's online.
Anywhere, because now we have a whole year. And you tell me you did not work, you did not do anything, you did not learn anything, and it's bad now. When you now get to a time whereby you need to survive, how do you want to survive? How do you want to even help your parents that are at home? Those ones, they are looking there, they are going out. Those ones, they even have more chances of even getting the COVID-19
more than you are staying at home. So we can overemphasize the fact that Nigeria is one nation that if we cannot dare to experience what they're experiencing in the Western world. We cannot take the risks. And let's understand, I don't know, our citizens, it's like we know ourselves. We know what we are prone to as a nation, and we still neglect ourselves. Yoruba date says, permits me, that our case is like something tofe porara, we're exposed. We're already in a bad economy. We already have a government that before you scream and they hear you from the grassroots, a lot of things would have spoiled. And now they're not telling you that yourself now, taking care of yourself is now your own responsibility. And you're like, they are saying their own. Nobody's saying their own. I told somebody, even if it is not real, even if they are lying, right? That's what we say a lot of times. Just wear it for the sake of wearing.
Just wear it. It's not going to cost anybody anything.
This is a time that all organizations should go back to without face masks, you're not coming. This is a time organizations should start saying you wash your hand at the entrance and use your hand sanitizer and all of them. Those are the time. This is the time that all those things should be put back in place. If not, lockdown, we are screaming we don't want another lockdown. They would lock down, especially Lagos, they'll just lock it down. Because once they know that they can no longer...
I think 772 cases yesterday, only in Lagos.
So once they know they can no longer manage it, they will lock down the states, they will lock down our economy. And our economy will be a mess if we go through it again.
Still talking about wearing of face masks. One of the people that have successfully affected the way people reason and the way people take this COVID-19 are the pastors. Very, very sad to say. There was a story online yesterday about a pastor saying that if other pastors are also wearing face masks, that means they are not supposed to be called children of God. They are not even sons of God. They are not even men of God, because they say they should believe. I don't know, understand that. How would we see a global pandemic, something that is killing millions of people, and you are telling me, okay, it even said in the Bible that heaven help those who help themselves. If you don't help yourself, you don't have the Bible, but if you don't help yourself, you cannot get help from God. It's like somebody saying, somebody that is selling, okay, anybody that say, okay, I'm going to get a car. I say, God is going to give me a car. Ooh, why would God give you a car? Is God manufacturing car? You work.
You get your money.
You work and get money and buy this car.
That's a good point you've actually said. That means our religious organization, how important they are in actually influencing people to do this thing.
Yes, now they are a voice on their own. It's not a time
to start preaching about buy this holy water and forget about COVID-19. Who is COVID-19? Yes, we believe the fact that, okay, God is supreme and he has control over everything. But don't forget that your health is still your responsibility. What is, they are not men of God. A lot of pastors are actually covering their face. If you should know, when you visit their houses, the strict, don't mind, the person saying it actually might actually have all the COVID-19 rules set up in his house. And they come out tomorrow and tell you, believe in the healing power of God. And yes, God heals. But God didn't tell us not to take precautions.
No.
God didn't tell us not to take drugs. In the Bible, he said he created herbs and all of that for us to actually, use it for human consumption. So let's just take care of ourselves. Don't mind what anybody is saying. And I also saw a video of a celebrity. I wouldn't want to mention his name. Who said, "What do we need the vaccine for? Our food is medicinal and all of that." Hello, look, this is the time to disregard every form of thing flying offline or online that somebody is saying to you. Pick up your phone, check on what's the new development on COVID-19 pandemic. How can I protect myself? Take full responsibility of yourself. Nobody is going to do so, because once you're tested positive, you're on your own.
Talking about phones and SIM cards, we have N9 and NIMC.
I believe that things have been put on hold.
The federal government have come out to say that they might actually stop it for a while, because we look at over 20 million people that have access to phones in Nigeria. How would they register within 2 weeks? So it's not going to be possible. And we are still talking about COVID-19, and you want everybody to rush you.
I want to believe that will be looked into with immediate effect. And then a lot of banks as network has actually been sending us on how you can actually do it from the comfort of your own. I guess the issue is with people who do not have the NIN itself. That's the issue. But if you have the NIN, there are a lot of codes from different network you can actually get it from. And I said, in case you opened your bank account with your national ID card, you can actually visit the bank to get it, or you can use a particular code to get it from your bank. So please just try to look for, when you need to do something that might make you be around large number of people, try to look for the alternative. Try to check online, how can I do this, this is the time to actually look out for yourself. And we hope that we are able to come out of this. We hope that just as the world was able to conquer Ebola and other things, we hope that this as well becomes a thing of the past. But don't forget, your life is in your hands, and health is wealth. We want to hustle. We know we need money. We need to eat. We need to do this and that. But yes, it's only somebody who is alive who does that. So please look out for yourself. And for the sake that our economy cannot try another lockdown, look out for yourself. We can go on and on how COVID-19 is actually, disrupting activities all over the world. But we have to call it a day. And still remembering you, wash your hands, wear face masks, use sanitizer, and you can now pray. Don't just wake up and start praying. Father, every spirit, please.
Rebuke Corona.
Don't just rebuke alone. Wash your hands, use your hand sanitizer, wear your face mask, and pray. Because we know we like prayers in Nigeria, yeah? We like prayers very much. So this is why we call it a day. Trust you have an amazing week while you continue to stay safe. For myself and Kayode.
Bye.
Bye.